Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to kick off Season 2 of our podcast series in partnership with Rappahannock Electric Cooperative. It's called We Are REC. Every week we'll release a new episode talking to different people from REC about a host of different topics. We'll get tips for saving money on your electric bill. We'll talk about renewable energy and the impact it can have in our communities. We'll get some behind-the-scenes info about what happens when the power goes out in a storm. Don't miss out on information about community grants, scholarships, REC-hosted events, and more. Get every single episode on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, or on Spotify. Just do a quick search for We Are REC. Hello and welcome to The Valley Today. I am your host, Janet Michael. We have got an interesting guest on the Zoom screen with me today. You, of course, are listening to the show on a Thursday afternoon. We are pre-recording it over Zoom on a Monday afternoon because I am going to have a very important conversation today with Dr. David Switzer. He is a board-certified family medicine physician at Valley Health Page Memorial Hospital's Family Medicine in Luray, and we are going to be talking all about masks. And I'm very excited to have this conversation with you, Dr. Switzer, because there is so much information out there, some of it right, some of it wrong, some of it somewhere in the middle. So I'm glad we're going to be able to maybe bust some myths today and talk about the positives of wearing a mask. So thank you for taking some time to have this conversation with me. I appreciate it.
I appreciate the invitation.
So let's start off with why we have to wear them.
With COVID-19, even though there are multiple modalities of transmission and ways that you can acquire the illness, we believe that by far the most important way that this illness is transmitted is by something called droplets, respiratory droplets. And unfortunately, it is difficult to know whether you are truly infectious, contagious, for COVID-19 or not, because we think a lot of the cases are completely without symptoms. And even in cases where symptoms develop, there is a time period before the symptoms arise where we think folks are infectious. So the importance of wearing a mask is to ensure that even though you're not having symptoms yourself, that if you are speaking or talking, or speaking or laughing, or coughing or sneezing, which should be red flags if you're doing it over and over. But if you're doing any of those things, that the droplets that normally come out of your mouth and nose that could be carrying the virus are contained within your mask and not spread to other people.
Now, is this something that they learned as they learned more about the coronavirus? Because I know initially that the CDC and a lot of our health officials on a national level said, you don't need to have a mask, don't go out and buy the masks. I know they've since said that was mostly because they didn't want there to be a run on them so that the frontline workers and hospital workers wouldn't have them. Have things changed? Have they learned more that causing the professionals now to say wear a mask?
Yeah, so just like with anything in science, things evolve. Early on in the illness, when we were just learning about it, it wasn't entirely clear whether masks would be an important form of protection. It wasn't clear how effective they were. And then also one thing you touched on that was intertwined with the mask discussion was healthcare workers who are at the front lines of managing this illness and obviously a very high risk of exposure were going to need masks. So early on, there were some very smart and thoughtful people who were, at the very least, ambivalent about the importance of wearing a mask because of the evidence we had at the time. Now, as we know in science, evidence is accrued as time goes on. Once upon a time, there was a prevailing theory that the earth was flat. And then as evidence evolved to counter that hypothesis, we abandoned that, or at least most of us did. And now we believe the earth is round. with the preponderance of the evidence that has accumulated with COVID-19, what we have found is what I alluded to earlier, the importance of droplets in terms of the spread of the illness. And now, both more accessibility to masks in general, and also evidence that masks are an important means to prevent the transmission. I don't want to get too much into medical mumbo jumbo, but I'll give you hopefully a helpful illustration that comes from kind of a combination of the lay press and the medical literature. A few months back, when the pandemic was really getting rolling in the United States, one of the important spreader events that was given attention in the media, as you may recall, was a choir practice in the state of Washington, in which it was believed that, if I'm remembering the numbers correctly, one person was responsible over the course of an hour for spreading COVID, unbeknownst to them. That it was early in the illness. They didn't know the importance. We didn't know we shouldn't be having choir practice. So not casting any blame, but one person transmitted, I should say, the illness to, I believe it was 52 other individuals. And of course, none of them were wearing masks. Fast forward to, I believe it was June or early July, there was a hair salon in Missouri in which I believe it was two hairstylists became ill with COVID. And it was estimated, once again, I believe I have these numbers correct, it was estimated that there was a potential exposure to 139 people over the course of the time that these individuals were working in their hair salon. And of those 139 people, none of them contracted COVID. And we have every reason to believe that it was because both the stylists wore masks and all of the patrons wore masks. And that was the one critical factor in terms of preventing the spread. You could argue that those are, to a certain extent, anecdotal, but I personally find those to be two very compelling stories that speak to the importance of masking.
Well, and the thing with the women in the hair salon, if I remember correctly, they had active symptoms. They had coughing and sneezing. They were full on, mild probably, but that's a big deal. The fact that they actually had the symptoms and still managed to not spread it to any of their customers.
Right, and I would have to go back to the article to be sure of the exact time course as far as when they became symptomatic and how long they continued to work. But yes, you're right, they were symptomatic.
So the other thing that I've seen a lot in the news is the types of masks, because I will tell you one thing, the good to come out of all of this is how creative. You've realized how creative people can be in what they're wearing as masks and what their homemade masks are made out of from a fabric perspective. I had no idea there were so many different types of fabric and patterns out there as I have seen in the last 3 months. Does it really matter what kind of mask you're wearing as long as you're wearing one?
The analogy that I make is, and this is, there's a little bit of speculation involved. I'll be fair and transparent about that. But the way that I look at it, as far as the way we understand masking at this point, it's kind of analogous to the way I look at the data around restraining babies and toddlers in a vehicle. So certainly 5-point restraints are probably better than 4-point restraints, and certainly up to a certain age and a certain size, it's important to rear face as opposed to front face. And certainly it's important up to a certain height for older children to make sure they're in a booster seat. But having said all that, to a certain extent, that's the statistical risk reduction frosting. The biggest gain is going from unrestrained to restrained. Okay. And I kind of look at this as similar, which is the biggest safety gain is going from unmasked to masked. Now, are we going to find out that there are certain types of cloth, certain fabrics, certain layering techniques that are going to be more effective? I feel sure that over time we will, depending on how long this goes on, and there will probably be expert recommendations regarding what masks are better. But I do feel personally, based on the evidence, and I would allude to that article once again about the hair salon, I don't know that there was any control exerted over those 139 patients regarding what kind of masks they were wearing. We just know that none of them got it. The spread is contained by masks, and I think at this point in time, we just go with the assumption that wearing a mask is certainly much better than not wearing a mask.
How about washing your mask? Is there like any kind of protocol for how often that should happen? I'm guessing the more you wear it out in public, the more frequently you should wash it. I have a half a dozen of them, so I got to rotate them through.
Well, and it's good that you rotate them. I've not seen any randomized controlled trials that guide us on mask washing and techniques and timing and all of that. I will say that generally speaking, it is probably good practice to hand wash your mask between wearing it daily. So in other words, if you wear your mask for a day, you should probably hand wash it with soap or alternatively put it in your laundry before you wear it again. And if you have several masks, then you have the luxury of not having to do that every single day. But as you say, you can have a rotation going where your mask is either being washed in a batch or cycled through your laundry.
And it goes back to just remembering to wear it. And that's part of the reason why I have so many of them is I have different bags that I carry out of the house for any number of different things. I have one that I keep in the console of my car, one that's in my purse, just so that no matter where I am and what I'm carrying, I know I have access to one. Having multiple comes in handy that way too.
Exactly. And that is very wise on your part.
I've had friends that have talked about how they always get out of the car and get to the front door of a store or some place that they're about to go into and then realize that they have forgotten them and have had to turn and go back to the car. And I was having that conversation last week with a group of chamber members in Front Royal, and one of the women owns a pottery studio in Front Royal, and she pulled out her lanyard. We all have lanyards that we have gotten in goodie bags or at ball games or for work. And she keeps her mask attached to her lanyard so it's not up around her neck, driving her crazy when she doesn't have to wear it. But she always has it on and has it with her.
That's a great idea.
Let's take a break because I want to get into some of the myths, because some of these I was familiar with, some I wasn't, and then I had a few of my own. So can we go over some of the myths about masks and COVID-19 when we come back in the next segment?
Absolutely.
All right, we're going to do all of that in just a couple of minutes. We are on a Zoom screen today with Dr. David Switzer. He is a board-certified family medicine physician at Valley Health Page Memorial Hospital Family Medicine in Luray. We're going to come back and have more of a conversation with him about the coronavirus and wearing masks in just a couple of minutes.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit at NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. We are having a conversation on the Zoom screen today about masks and the coronavirus. Dr. David Switzer is joining me on the screen. He is a board-certified family medicine physician at Valley Health's Page Memorial Hospital Family Medicine in Luray. And Dr. Switzer, we were talking during the break about some of the myths that I have heard, some that I have seen on Facebook that I will tell you just are beyond ridiculous in my mind. And then I have a few questions that I want to ask you too. So I'm going to start off with, if I'm not sick, I don't need to wear a mask. Is that true?
That is not true. Circling back to a comment I believe I made earlier in the first segment, we know that there are people who have COVID who have no symptoms. We know that there are people who will develop symptoms of COVID but are transmitting the virus during a phase without symptoms. We think that phase is probably about 2 days before the symptoms develop during that 48-hour span. So even if you are not symptomatic, you could still be contagious. So it is still very important for those without symptoms to wear a mask.
So myth number 2 is that there are drugs and products that I can use to keep from getting COVID-19.
To my knowledge, there is no definitive randomized controlled trial that demonstrates that any one product, any one drug, any one vitamin, any one supplement truly reduces the likelihood of your contracting COVID. And I think where these myths get started is sometimes myths start with a nugget of truth. And so there is some science-based speculation that there are some supplements, vitamins, drugs that may either help reduce the likelihood of contracting it or reduce the severity of it if you get it. If you have questions about anything that's on your mind in that regard, I would strongly encourage you to speak to your healthcare provider about them, because that is evidence that most of us try to keep up with.
And that can all be done over a telehealth visit.
Exactly.
I try to squeeze that telehealth in wherever I can when I'm talking with a Valley Health doctor. So myth number 3, exposure to high temperatures prevents COVID. It's 100 degrees. It's been 100 degrees for a couple of days now. It's not going away in the heat, right?
Right. I think this is a myth that has largely been dispelled for most people at this point. A month or two ago, what I would point to is the viral activity in places like Africa, or of course, one place that makes the news a lot in the last month or two is Brazil. I think it's pretty hot in Brazil for the most part. There's no reason to think that the ambient temperature changes the spreading of the virus.
I remember growing up, my grandfather used to say when there was a particularly bad flu or cold season, that what we really needed was a hard freeze. We needed it to be really cold and get a lot of snow for a week or two, because that would freeze everything out. So could the opposite be true?
Theoretically, we don't have any evidence to back that up. I've heard the theory, once again, in terms of myths evolving from a nugget of truth. If that was observed, it probably was not the freeze itself. It was probably the fact that a heavy snow prevented people from congregating for a while. Then the virus didn't spread.
So myth number 4 is thermal scanners can detect COVID-19 before people show symptoms.
To my knowledge, once again, I know of no trial that demonstrates that to be true. The only thing that is even close to that, and it's not very close, is we do screen patients who enter our clinic and employees every day for their temperature. And if their temperature is above a certain threshold, we do not admit them into the clinic, and we figure out if they need COVID testing.
When this first started, I joked that I wished I had bought stock in Zoom, because I would be such a millionaire or a billionaire right now. And then as time went on, I joked that I wish I had bought stock in makeup, because we're all looking at ourselves so much more now in Zoom than we are when we're face to face with people. And now I've kind of decided that I wish I had bought stock in those thermal thermometers, because nobody takes their temperature by putting it under their tongue anymore. Everybody has those forehead, no contact thermometers. And I wish I had bought stock in those
Exactly.
6 months or a year ago.
Me too.
Myth number 5, there are many ways that COVID-19 is spread from person to person, including by mosquitoes and houseflies.
So once again, to my knowledge, the mosquito, housefly, or other insect vector has not been borne out in any evidence of which I'm aware. In terms of multiple ways to spread COVID, theoretically, for example, if someone happened to come into my office and sneezed on my keyboard and they happened to have COVID, and then I came in immediately after, typed on my keyboard and started rubbing my eyes or rubbing my face, could I get it from that sort of contact exposure? Theoretically, yes. Having said that, once again, as I believe I commented in the first part of the program, by far our understanding is that the most important mode of transmission is the respiratory droplet transmission. So that's the one we need to worry about. That's the one we need to act on. And if we come up with strategies to mitigate that transmission, that will go a long way to reducing transmission as a whole.
So let me ask you a few more mask questions kind of related to that. In the governor's order, masks are mandatory being worn inside, but there is an exception to that if you have a medical condition that would prevent you from being able to breathe or go about your business with a mask on. I know that there are some medical conditions like that. I have family members that suffer from COPD, for example. My argument to them is if you have COPD and can't wear a mask, you shouldn't be out in public exposing yourself to this anyway. But talk to me about what some of those medical conditions are and why wearing a mask is still important, and maybe you should forego going out altogether.
Sure, and this is a difficult thing, and I empathize with people who have medical conditions that make it difficult for them to wear masks. Obviously, one of the first ones that comes to mind is in the class of respiratory conditions. And as you said yourself, COPD is one of those conditions listed by the CDC as a high risk for acquiring severe COVID, but it's also a condition where it might be difficult for somebody to wear a mask if they have COPD. So the way that I try to explain it to patients of mine is I'm not a law enforcement person. I'm not a regulatory person. I'm certainly not a political person. I'm a medical person. So the view I'm going to have on the situation is going to be entirely medical. And when I look at a patient of mine who has severe COPD, such that they are telling me my breathing is so bad that when I put on a mask, I feel like I'm going to suffocate. I can't manage. My response to them is, you should not be anywhere in this day and time right now. You should not be anywhere indoors with other people where there is anything other than a universal masking policy. And by definition, if they're allowing you in without a mask, there's not a universal masking policy. They're letting other people without masks in as well. And that's putting you in danger. So is it challenging? Is it difficult to start thinking through the process of, well, who in my family can run into the grocery store for me? Or can I possibly manage with a mask for 5 minutes so that I can go into the bank and conduct this business that's otherwise going to be very challenging for someone else to do? These are the decision processes that these unfortunate people have to go through. But there is nothing magical about having an underlying medical condition that makes it safe for you to be around other people without your mask on.
So what is the risk to me? So let's say I am at Target, which is my happy place, and I am wandering around and I have my mask on, and then I encounter somebody on one of the aisles that doesn't have a mask on. I know that in theory, me wearing a mask is protecting them, but to a certain degree, it's also going to protect me from that person who isn't wearing one. Or is that a myth?
It's not exactly a myth, but the evidence that a mask protects the wearer is marginal if they're in the presence of someone without a mask, because clearly the effective strategy for reducing the spread of COVID, both in the healthcare setting and outside, is what we call source control. If you are a potential source of COVID and you have a mask on, that really reduces the risk to the other people around you. Now, if you are not within 6 feet of that person, your risk goes down significantly. If your interaction or the sharing of space with that person is for a very short period of time, your risk also goes down. But wearing your mask, while I would certainly encourage you to do it, is probably only going to modestly protect you.
I've not been the nicest person in public when I've come across people without wearing a mask, and now that's probably going to get worse. So anybody who's listening that ever sees me in public and isn't wearing a mask, you better brace yourself, because I am going to let loose.
Now, the one, and once again, trying not to get too tangential, the one exception to that would be if, for whatever reason, and we like to try to keep these reserved for the healthcare setting, but if you happen to have what is called an N95 respirator, which the proper term for that is respirator and not a mask, which are sometimes used not only in the healthcare setting, but on construction sites and those sorts of places where fine particulate matter could pose a risk to, say, a construction worker. And you are assured that it is fitted properly with a seal all the way around your mouth and nose which is a little bit challenging, then yes, theoretically an N95 would protect you as well as the people around you. The reason I make a comment about that is occasionally I will see people wearing those in public, and one of the points I want to make is that if your version of the N95 is the one with the valve that is over the mouth, then that's really not protecting anybody around you because your air is escaping through that valve.
So my last myth that I want to bust is if I am feeling sick, I shouldn't go to the doctor because then I could get coronavirus.
So a couple of things there. Are we concerned about protecting anyone and everyone who enters our healthcare setting, particularly if they're not having respiratory symptoms? In other words, if I have someone who is having symptoms that are concerning for their congestive heart failure acting up, or they have an infection of the skin of one of their legs, or whatever the case may be, something that I guess I would say something that is clearly not COVID related.
Diabetes, for example.
Your sugar is way out of control. Let's use that as an example. First of all, at least in the Valley Health ambulatory setting, we have gone to great lengths to treat patients with respiratory symptoms in a separate location than where we treat patients with other chronic conditions. So speaking personally, and I think I speak for all of the primary care sites in Valley Health, if I invite you to come to my clinic for care, if my staff invites you to come to our clinic for care, we are inviting you with the confidence that we have done everything possible to make sure that you are safe from COVID exposure while you're here. In addition to that, I would also qualify the statement or modify the statement with which you open that question. If you are sick, whether or not it turns out to be correct to come to your doctor's office, you should at least contact your healthcare provider. If there's a question about whether you have COVID, they can give you direction as to how you proceed. It might not be coming to where I am, but it can certainly be going to where you can receive the appropriate care and the appropriate testing. So definitely contact your healthcare provider if you're ill. They will guide you as to what the appropriate course of action is for your safety.
Finally, 5 facts to remember. Walk me through the 5 things that I can do to limit my exposure or chance of getting coronavirus.
So to limit your chance of exposure to coronavirus, as I mentioned earlier, I would keep it on the list. But once again, wearing your mask is modest protection for you. It probably is some protection, so I would keep it on the list. Also, consolidating your errands. You probably would be well served by making sure that when you go to the grocery store, for example, you have a list of things that you're going to pick up that is going to last you for a matter of weeks rather than a matter of a couple of days, because each time you enter an environment like that, you run the risk of exposure, even if you're doing all the right things. When you are in those environments, number 3, I would say would be make sure you're keeping your social distance. If you're maintaining that 6 feet apart, then you will do well in terms of reducing your own exposure. Another thing to consider is if you want to or need to interact with other people face to face. Sometimes we have to do that, and there's really no way around it. If you can do that outdoors instead of indoors, then that's probably safer, particularly if you're in an outdoor setting and can maintain that 6 feet of distance, then that's important. And I know that I'm probably going to run over 5, but I guess the one that your mom taught you long before COVID came along, wash your hands. Keep washing your hands. If you can't remember the last time you washed your hands, wash your hands.
The other thing I want to make sure people understand is just because the likelihood that you're going to pick up the virus on a surface is slimmer than getting it from somebody breathing or coughing or talking to you, you still need to wash your hands. Don't think that, oh, I don't have to wash my hands anymore because they've decided that it's not as likely that I'm going to pick it up off of a countertop somewhere.
I appreciate you making that point. That's absolutely right. Less important does not mean not important. Is that a less important mode of transmission than droplets? Yes, we think so. Is it unimportant? Not by a long shot.
If somebody is listening today and they're interested in making you their primary care physician, or they want to reach out to your office for an appointment or a telehealth appointment, how do they do that? What's the best way for them to reach out to you?
I'm in a system of clinics in Page County affiliated with Page Memorial Hospital. So depending on where you are located in the county, there are convenient offices in various places. Like, for example, if you live in the southern end of Page County, we have an office in Shenandoah. If you live in the northern part of Page County, my office or one of the other offices on the hospital campus would probably be more convenient for you from a geographic standpoint. If you want to get plugged in, you can obviously look up Valley Health Page Memorial Hospital online, and you will see a selection of the clinics there with their contact numbers. The main hospital number here is 743-4561.
Today's conversation was with Dr. David Switzer. He is a board-certified family medicine physician at Valley Health Page Memorial Hospital, Family Medicine in Luray. I will have all of the contact information and these myths on the show notes page for theriver953.com. You can head over to the website and see those now. Dr. Switzer, thank you so much for having this conversation with me. I have learned a lot today, and I hope those that are listening have learned a few things that they will take out into the community, and we'll have a good community spread for a change.
Thanks a lot. I appreciate the invitation.
I'll see you back here tomorrow.